watching Parker Success Academy with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, and this is Parker Success Academy, where we explore models of business success in chiropractic practices. Today, I have a very special guest, Dr. Jason Hulme. Jason, welcome to Parker Success Academy.
Dr. Morgan, thank you so much for having me on. I really can't thank you enough. I think this is going to be just a great use of our time, and I think we're going to have a blast.
I think so too. So can you tell us a little bit about yourself and your practice?
Absolutely. I opened my practice 11 years ago here in Nashville, Tennessee, and our practice is focused around active care. So there are 3 chiropractic physicians in our clinic, and there are 4 chiropractic therapy assistants in our clinic. And one of our biggest focuses has always been on making as big of an impact as we can in our community, working really closely with our healthcare colleagues of multiple disciplines to be able to affect as many patients as we can.
So can you tell us a fun fact about yourself, something that most people wouldn't know about you?
Oh, that's a good one. I would say a fun fact is between myself and my daughters, who are 4 and almost 6 years old, we've seen the musical Hamilton either in person or on video or listened to it well over 100 times.
Wow, that is a fun fact. I need to watch it for the first time. So can you explain your definition of success?
I would say my definition of success, I think we always have a couple of different big pillars, or think of them like glasses or cups that need to be filled. We have that emotional side, and then we also have that financial side. To me, I'm way more on the emotional side is what matters to me the most. So for me, it's all about whatever I can do to help influence our community or see the success of our patients day in and day out. And there just be this great vibe in the clinic all the time, where you just know that everyone's working their hardest to get better as much as they can. And then when they come in, they just know they're in the right place. I think that's it. When you walk through the clinic on a Thursday and you have a shadow in the clinic and you can just feel it, that energy's going and people are working their butt off, like that's my success right there. When you feel that, it's like I just know the rest of the week and the weekend's going to be awesome.
That's awesome. And most chiropractors experience that. So can you explain your business model to us?
Absolutely. So our business model is, like I said, an active business model. So when a patient comes into our office, they're typically sent by either medical referral or the patient was a medical referral that got better and enjoyed the experience, and now they've referred someone else. So that's how typically patients get into our clinic. That's our marketing approach. From there, once a patient gets into our clinic, we do what is called the selective functional movement assessment on every patient. So we look at full body movement to help our diagnostic process. And then from there, we're able to start narrowing down to find out what is that medical diagnosis and then what is that functional chiropractic diagnosis that we're really going to be working on. And then from there, it's working them through the clinic to go from that. They need that hands-on passive type care to getting them active in some kind of movement or rehabilitation day one. And then over time, moving them to that higher level of self-efficacy.
Say that hierarchy where you start from relatively passive, but you're empowering them to self-care, it sounds like, as well. Is that true?
Absolutely. That's our most important thing. And actually the building that we bought was built literally with that whole idea in mind, that when you walk in on the front end, it has that very home environment, that medical still there to help you from the chiropractic side. But then when you walk through those doors in the back, it opens up to full on active rehab. So we have 3,500 square feet of active care in the back half of the building, which is just that natural progression that we want to see. And as patients walk to go back to the restroom, or as we walk them back there, they always say, "Oh, I had no idea this was here." And that's like, well, this is about to be what your future looks like. So let's go get it.
Well, you would enjoy coming and visit Parker University. We just opened up built a 21,000 square foot functional fitness facility here. It's fantastic. So,
I love it.
In addition to chiropractic, what other treatments do you offer or professions in your practice?
So in our office, it is all chiropractic physicians or chiropractic therapy assistants. So when we think about the care that we offer, adjustments are at the top of that list. After that, we do perform dry needling. Acupuncture is offered specifically to our VA referrals in the clinic. We do have a class 4 laser, but other than that, it's all active care. From the active care side, we do utilize, blood flow restriction and some of these other active modalities, but again, it's still keeping the goal, which is getting that individual as active, as strong, back rehabilitated, so that they understand that they can take control of this condition and that they understand the rules on how to stay better. So
patient empowerment is what I'm hearing. Do you have any books that you're reading right now, or any books you'd recommend? I mean, besides Hamilton?
Hey, that's actually a really good book if you wanted to get into it. I mean, it is 800 pages, but the Hamilton book is actually really, really good by Chernow, if you were wondering. But if we're talking about personal books, or do you want clinical? Which would you rather have first?
What's a book that's impacted you greatly, maybe this last year or in your practice?
I'd say Stillness is the key. That is an absolutely great book by Ryan Holiday. And I really, when it comes to clinical, it's still probably my favorite book, even though it's not in print anymore, is Chad Cook's book, Orthopedic Assessment, because that was the first introduction that I had when that first came out to the idea of joint clusters and looking at these orthopedic tests and finding out, all right, now this utilization, which ones are going to be the most effective to give you a better idea of what's going on in that clinical picture.
Well, it makes sense by hearing how your practice is that you would like Dr. Cook's books. I also, by Ryan Holiday, I've not read that book, but I've read The Obstacle is the Way, which has been a very good book. Ryan Holiday is a favorite author of mine. I've really enjoyed his writings. So what's the worst moment you've had in your practice or in your professional career?
Worst moment in the professional career would probably be pretty early on. I remember about 9 months in, it was at a Chamber of Commerce meeting. It was the one that I thought was going to be a big highlight, because I was actually there to speak on TMJ disorders and how we can help those. And I actually did pretty good in the presentation. It wasn't my best day, but I still felt pretty good about it. But right after, there were about 50 people in the room, and someone came right up to me and they said, my son is having really bad TMJ issues. I'd really like to send them in. And they went to shake my hand. And when they did that, they had a business card in their hand. So when I'm shaking their hand, I'm feeling this, what is this? And the look I gave them was probably the least professional look I could have pulled off in that moment. And that didn't go well, because everybody noticed I didn't do my best. So that's probably
if that's your worst moment, you got to pace yourself. So what was that pivotal moment in your journey?
Pivotal moment, probably the most pivotal, was about 4 years ago. Insurance, our biggest payer, so about 80% of the insurance in our city is by one major payer. And they went from a fee-for-service model, which is probably the most successful way when it comes to rehabilitation, because the number of units that you performed, you can actually bill for and get reimbursed appropriately. They went from that to a per diem model. So they basically did a 45, 50% cut across the board, which when they're actively in your clinic 45 minutes to an hour, that's a dramatic hit. Oh. I think the most pivotal part of that was not only the emotional, because that was July 4th weekend. We were coming back from vacation when we got that letter, but also what it made us do was sit down and say, well, we know what our non-negotiables are. And our first non-negotiable is we're not giving up active care. We're still going to make this work. We're going to do this the right way, but how the heck are we going to pull this off? And that really led to hours and hours of restructuring and finding out how we can be far more efficient, how we can use a bigger team from the therapy assistant approach to really streamline everything that we're doing. And where before, I guess we could have been a little lazy and still been okay to have that middle-class lifestyle we really wanted. But at the end of the day, that was completely gone now. So that would have to be the most pivotal moment that we've had in our 11 years in practice.
Well, I think that kind of leads us into where your practice model is, because I know you have a real passion for training CAs. But before we go to that question, I would like to ask, what advice would you give a younger version of yourself as you graduate from college?
I think the biggest thing would be, if that advice could be digested and utilized, I would say don't ride the emotional roller coaster. However, even if I got that advice now, I don't think I could utilize it very well. So I think the real answer would be constantly be ready to change. And the most important tip I would give would be that same moment that we had about 4 or 5 years ago, where we had to sit down and look at the reality of the situation. I would say every 6 months, sit down and put together your worst case scenario of what could happen, and then develop the strategies for that. Because if that's in place, Now your systems, you're ready to pivot as soon as something happens, as opposed to having to then go through the stages of coping and then also try to make a good decision. So instead of snowballing bad decision after bad decision, always be planning for that worst case scenario and knowing what avenues you would go to, which will ease your mind a ton in the evening and allow you to get to bed at night.
Well, from the outside looking in, it seems to me that the biggest danger you have, and I say this to everybody, the most dangerous number in practice is one. If you have one source of income, you're at their disposal. If they go away, you have nothing else. So if somebody pours everything into PI or to whatever, workers' comp or whatever it is, you only have one source. If a law changes, you're up a creek without a paddle. So chiropractic marketing and advertising to patients has been a big topic. What tips would you give based upon your practice about that?
I think the biggest thing would be for us is that, we've specialized pretty hard in how we market. So either we're doing social media where we're doing interviews like this, or we're spending one-on-one time conversations with other experts and other fields in our community. I think that's a big one. And then for certain individuals' characteristics, they may not actually love just going out and joining a chamber or going to a Rotary Club and feeling like that they're just forcing themselves in that environment. I think the biggest thing is that realize that you actually don't always have to do that. You don't have to just force yourself into what, the top 5 list that you Google that says that you have to do. I think that you can find where you're the most comfortable. And where I find myself the most comfortable is always talking to other healthcare colleagues about, asking them, what are their tough cases or how we can help them, et cetera. And just building that team model. For so often, so many chiropractic physicians feel like that they're almost alone on an island sometimes. And I really feel like that's not the case. Every one of these patients has a primary care. And if you can have a good relationship with them and know that you're working that case together, it inherently gives you this massive connected field of community. And in turn, that ends up being a great relationship back and forth to be able to work with them. So for me personally, that's what worked absolutely the most, because so many of those others, like I talked about that, when I gave that talk that I thought was really great at the chamber, awkward things would come up, and it just wasn't my favorite place to be. So I think that knowing yourself and where you can strive and still putting yourself out there can really go a long way, but attack success in the things that you're confident first and then grow from there.
I think the next question is going to bring us towards what your real passion is so we at Parker frequently talk about the 10X concept. What's something that you did in your business that had a 10X return on your effort?
I think the first would be always seeking that continuing education, and then realizing that you've gained so much continuing education over time that you can really level up your own team, and being able to bring that back and just always do training. So I would say our number one thing that we've done that's been that 10X, like with our clinic, has been every Wednesday, we start at 9 a.m. in the morning and we play a competitive game to get us going for about 15 to 20 minutes to get us awake. But then we deep dive into continuing education with our team, and then working through tough cases that we're having. So we do that for 3 hours every Wednesday morning. And that's been the biggest thing, because things will come up that are very challenging that all of us providers will have, or say Dr. Ethan or Dr. Alec in our clinic is seeing a case, and then I see them, and we're able to wrap our head around those tough complexities. But also to be able to say, like, here's all these great things we learned about this case, or for each individual to show their expertise to the team, constantly builds that team environment. And that is something that transfers to the patients immediately. If any of our therapy assistants start working with the patient, there's never this awkward hesitancy of like, what's going on? They just know it's part of the team, and they expect that they're going to be working hands-on with them, or they're going to be doing that range of motion assessment with them that day.
Well, it sounds like you elevate your team, but you always return focus onto the patients. So that sounds
Absolutely.
Like a very good thing. So I think this brings us into the main crux of what you'd like to talk about is training systems for one, but also training back office CAs. Is that true? So
Absolutely.
Tell us about that.
I think for some reason, as chiropractic physicians, I don't know if it's pushed onto us or if we accidentally just take this away, but when we're graduating school or going through school, there's almost this hero ball type approach, meaning that the provider is the only one that can do any of the things that really help advance care with that patient. And at least that's how, when I came out of school, that was the idea, was that I was the only one that could take that range of motion accurately, or I was the only one that could do that soft tissue technique, or I was the only one that could cue them how to do a lunge without knee pain and those things. And once it really sunk in that that is not the case, then it became inherent that I only have so many hours that I can work hands-on with patients in a week. And the reality is, when we ran the numbers, it didn't matter if it was me, if we had 2 docs on the team, if we had 10 docs on the team. By the time you run the numbers, if it's just providers, we still can't even move the needle in our community of seeing enough patients to where the entire community experiences what we want them to experience from all the great benefits of chiropractic. So the only way that you can start scaling that really at all is if you have a team of providers, and your therapy assistants are a major component of that. And so the idea behind a chiropractic therapy assistant, that's what we call them in Tennessee, that's what their license is. But at the entire nation level, we talk about that certified chiropractic clinical assistant. And so that is the certification that you can seek outside of that is offered by FCLB. And I'm the chairman of that committee, so I'm a little biased that direction. But the reason I am is because so many providers didn't realize that you could have a team of individuals that cared as much as you do to be able to help that patient and to be able to move them forward, and they can be on your team and they don't have to be a provider themselves. And so taking that idea and saying, okay, well, now how the heck do we structure a system around training that? Because there's so many elements to it. But I think the first thing that I would say to that is it's all about starting small, one step at a time, but knowing that over time as a team, if you build towards these certifications, the individual realizes like, man, I actually have potential of a real career here in this practice, as opposed to having to seek growth other places. So I think it's an unbelievable opportunity to get hands-on right away. I think it's the perfect fit for our profession. And I am biased, but I think that our profession is the perfect place to have this great assistant base that's building like crazy, because it's such a fun type environment to help see someone go from in a lot of pain to being able to do really great things again, to be able to squat from deep in a low position, be able to pick up their grandkids again, to lift things overhead again. So being able to have a team do that and see the success of your therapy assistants do that. And, you know, the first time I can remember watching a therapy assistant, I didn't even show them this piece, but they just witnessed enough of the cueing. They were like, hey, I think this is how you need to lift that. And they could instantly do it pain-free, and they could add 20 pounds to it, and just blown away. Instantly, you knew you had that team active care environment that you were really looking for the whole time.
Wow. So CAs, I know in Maryland, they require certification for back office CAs. Tennessee, how many other states require a certification or training? So
right now, depending on how you read the laws, there's 11 to 13 that have some level of requirement. Certain states are a lot harsher about that, if that makes sense. So you have Alaska, you have the Dakotas, you have Tennessee, that have that more specific requirement. Certain states like Chicago say that if you have a provider, or like Illinois, if you have a doctorate license, they can directly work under you immediately. So I think each state's a little bit different. It's important to really go through your statutes and go through your rules, your chiropractic rules in that state, to understand that. But I think in almost every state, you can have some type of hands-on. It just depends on how exactly do you have to navigate that from a certification perspective.
In those states, do they require ongoing CE?
Yes. And so, for example, in Tennessee, it's 6 hours per year. And then in certain states, it's 6 every 2 years. So depending, there's absolutely a requirement for continuing education.
At Parker Seminars, we always have a CA continuing education in classes. A lot of it's on billing and front office, but this is interesting to hear the back office side, especially for states like Tennessee, where you call them therapy assistants. Now, you talk about chiropractic physicians and dry needling and function. So which school did you go to, Jason?
I went to Logan.
Logan, got it. So all these things are interesting. So let's see, anything else you want to share about, because I know you have a passion for this, and it sounds like this is the secret sauce that allowed you to see more patients and overcome that per diem pay schedule versus the itemized pay schedule. Is that correct? So
Absolutely.
it was a full force multiplier. So where do you see chiropractic going in the next 5 years?
I think where this is going is getting more highlighted. It's exactly what we're trying to train providers towards, which is the reality of the situation is that your time is going to be getting split more and more, but you need to be prepared to not let quality dip. I want it to be a non-negotiable in chiropractic that your quality of care does not diminish no matter how split up your time becomes. And the only way you can do that is to have a team environment with trained up clinical chiropractic assistants that are able to help take 80% of the burden off of you because they know exactly the cue that they're going to give them, or the nerve mobilization they're going to show, or the way to stand up without hurting their back with that diagnosis. You've got to have those that can spend that time, because what we're seeing is more and more websites that are creating these videos that you can now go share to them. But we're also starting to see the other side of that, which is, oh, you're going to send me that exercise and now I'm going to watch that. But you know what would have been a lot better would be if Cheryl would have just shown me how to do that. And then there's that connection piece. And then they're always tying that back to, they remember that they did that with you in office. You were there for them. That's the piece. It's not that, oh, I'm just sending this exercise. They're going to walk me through it. But the way that you can make that happen is by having that great trained staff. And I think that's what's incredible about what Parker Seminars is doing, by having more opportunities to be able to train those assistants. But I think it's important that assistants learn a little bit different than, say, our providers learn, right? We have that just different base that we're coming from. And so I think it's important that we're able to hit that from all angles.
Well, when I first became president here at Parker, my staff told me there's a phrase: the president should only do what only the president can do. And that's probably true for doctors. The doctor should only do what only the doctor can do. So that because if you're doing something that you can pay someone $15 or $20 an hour to do, now you're working for $15 or $20 an hour. So it is important. There's that you hit those thresholds in practice where to keep getting growing, you have to have other people behind you helping you out. So what is one takeaway you'd like to leave with the audience? And after that, could you leave us some contact information for you, Dr. Hulme?
The number one thing I would leave you with is, I would say, go home, write down on a piece of paper, here are the 10 things that I feel like I cannot possibly give up in the clinic that I have to do. And then I want you to now take 5 of those and then have that harsh conversation with yourself and realize actually you can. So don't let the ego get in the way there, and find the creative solutions and how you can do that. And then once you find those, how are you going to actually have the trust to be able to have someone else take over those roles, to be able to help level up in your office? And it all comes back to the same thing. If you're deeply seek inside, like we've done many times, the reality is you want to help as many people in your community as possible. And to do that, you have to have help. And you have to be able to trust them. And the way that you're going to do that is with better education and being able to give them the responsibilities that keep them excited about it, that they also have a great impact and can fill up their emotional cup in the clinic. And that's where it comes from. So many people want this role to be able to be a clinical chiropractic assistant. The reality is they don't know the profession's there. And so that's one of my biggest things, is to be able to help educate everyone, to let them know that this is there and see this initiative keep growing. But it's got to start with you. If you're watching this right now, this is where it's got to start, in your practice today, or in the practice you're going to open. So I think that's the most important thing that I could possibly share today. My name is Dr. Jason Holm. My email is drholm@activesjc.com. That's the easiest way to get hold of me, or movementconsults.com.
Dr. Holm, thank you so much for joining us today, and thank you all for joining us here at Parker Success Academy.
Thanks for watching another episode of Parker Success Academy with Dr. William E. Morgan.